Hi, I am Orko Chatterjee from India. I am 23 years old. You must be thinking of what the fellow is doing here, mingling some stupid educational video. Well, I am here to educate you about what hypertension is. And I think I am the best person to do so because last week I was diagnosed with hypertension. I study a bit I want to share with you. Let's come to the matter right away. Let's look on heart. The the whole deoxygenated blood come to this path, superior vena cava, and this is the inferior vena cava. Then it goes to the lungs for oxygenation. After oxygen exchange take place, it comes to the heart again, and then it is recirculated to the body through major arteries. I am trying to draw a rough sketch of the artery. These are the arterioles wall, and blood is passing through from right to left in this direction, and these are the blood's corpuscle. As you know, when the liquid is passing through a tube or pipe, it creates pressure on the wall of the pipe or tubes. Similarly, when the blood is passing through the arterioles, it also creates pressure on the wall of the arterioles. The blood is a thick liquid and the vessels are narrow. So to make the blood pass through the vessels, it required forces. To make the blood pass through the blood vessel, the force is needed. The force is generally generated by the rhythmic contraction of the heart. When heart beats, the pressure goes up. When it relaxes, the pressure goes down. But there is always a pressure on the vessel of the blood. So the blood pressure goes ups and downs. The up pressure is called systolic pressure and down pressure is called diastolic pressure. BP is expressed as systolic pressure over diastolic pressure. Systolic pressure over diastolic pressure. I am using the Wacom pad for the first time. The writing is pretty bad. When we come to the point hypertension, there is a two term, hyper and tension. This is hyper and tension. Hyper means over or above, and tension means the tensile force onto the vessel. This is the tension. So both the terms come together and this is called hypertension. But what is the problem regarding hypertension? The hypertension is a disease that is the blood pressure is over or above the normal. Okay. So what is the problem regarding blood pressure or hypertension? When the high amount of force is applied on the wall of the vessel for a sustained period of time, the vessel may be damaged. And you know, when the damage occurs, the blood vessels is unable to transfer the blood to the furthermost part of our body. So that is the general problem regarding the hypertension. Actually, there are mainly two types of hypertension. One is primary hypertension and another one, can you guess? That is secondary hypertension. Firstly, I come to the secondary hypertension. In the secondary hypertension, the cause of the hypertension is generally known, generally due to the kidney dysfunction abnormalities in the endocrine system. These are the main cause of the secondary hypertension, and it is generally seen 10% of the patient of the hypertension, and the first is the primary hypertension, where the cause is totally unknown. Okay, then come to the point, the sign and the symptoms of the hypertension. Practically, the hypertension is a asymptomatic disease. There is not any prominent symptoms of the hypertension. There is some vague or non-specific symptoms such as lightheadedness, headache, fatigueness, and malaise is generally seen in the patient who are suffering hypertension.